Hello, today we are going to discuss the ways and means to prevent a stroke. Stroke is one of the leading causes of death and disability following heart attack and cancer. And stroke, as you know, can cause paralysis of one half of the body most commonly. And once somebody gets a stroke, treatment has to be done as early as possible. Otherwise, it can lead to disability and death. So what I mean is that the best thing is to do something and take measures and precautions to prevent a stroke. So today I am going to discuss 12 strategies regarding how one can prevent stroke. So first always is the sleep. People have shown that research has shown that those who sleep less than 7 hours, especially if it is less than 6 hours or more than 9 hours, both the groups have a higher risk of stroke. So always ensure 7 to 9 hours of night sleep. Second is exercise. Now exercise importance is well known, and all the research studies have shown that people who engage in 30 minutes of exercise at least 5 days in a week, that is total of 150 minutes of vigorous exercises minimum. More is always beneficial. They have a lower risk of stroke, and that exercise can be brisk walking, running, cycling, swimming, whatever one likes. Along with that, one can always do strength training also 3 to 4 days in a week. And then other than these, one can look at the steps, and many studies have shown that those who walk about 8,000 steps or more up to 10,000 in a day, they have a lower risk of developing stroke. The third is the diet. So we all know healthy food and healthy diet can prevent the onset of diabetes, obesity, and also reduce the risk of brain stroke. So healthy food means eating less carbohydrates. So diet which has mainly say roti or rice, sugar, sweets, soft drinks. So these should be minimized or consumed as little as possible. Have more proteins, more fruits, that is whole fruits and vegetables in your diet. So this will definitely reduce the risk of developing stroke. And then maintain normal body weight. So when we say normal body weight, we look at body mass index, which depends on the height of a person, and body mass index should be less than 25 to call it normal. If it is higher, then it is overweight, and if it is more than 30, it is obesity. So one should do exercise and diet control to keep the body weight normal, especially the fat content should be as little as possible. And then nowadays, sitting is the major risk factor for stroke. It is also called sitting is the new smoking. So one has to minimize the number of hours of sitting, preferably to less than 6 hours in a day. And if the job involves sitting for long time, every 30 to 40 minutes one should get up from the chair, move around for 1 or 2 minutes, and then come back and sit. The coffee breaks, the tea breaks, and the lunch breaks, if possible, have in standing position. No need to sit at that time. In the office meetings, many times people just those who present, they are standing, but other people sit and listen. If possible, try to stand at that time. So standing is definitely healthier than sitting. And then in between, whenever possible, just move few steps, keep moving. So moving is better, and that will reduce the risk of stroke. Definitely smoking is harmful, so those who are smoking should quit smoking. Same thing applies to alcohol also. Abstain from alcohol. So both smoking and alcohol consumption increase the risk of stroke, and that should be avoided at any cost. Stress is a risk factor. Reduce the stress, minimize the stress, and try to remain happier. Do things that you like and what you enjoy. Then looking at the diseases, so blood pressure is a major risk factor. Anyone who has a blood pressure of more than 120/80, the risk starts increasing, and higher the blood pressure, greater is the risk of getting a stroke. So keep the blood pressure normal. If needed, take medicines also. Same thing applies for diabetes. So pre-diabetes as well as diabetes, both are risk factors for getting stroke. So HbA1c up to 5.6 is good, and then 5.7 to 6.4 is pre-diabetes. Even though fasting blood sugar also more than 100 is again a risk factor. So keep the blood sugar to as low as possible. Even HbA1c as low as possible is better to reduce the risk of stroke in the future. Cholesterol also should be kept within normal limits. Total cholesterol less than 200, LDL cholesterol less than 100, triglycerides less than 150, HDL greater than 50. So all these are parameters which will reduce the risk of getting strokes. And then one more thing which people don't talk about much is the homocysteine. Homocysteine, if it is high, it is known to be a risk factor for both heart attacks and strokes. So when you are doing your regular checkups, also get the homocysteine tested. If it is more than 15, then simple vitamins can be taken to make it within the normal limits. So I'm sure if you follow these 12 things, the risk of stroke can be minimized to a greater extent. So just to enumerate all the 12 once again: sleep, adequate sleep, regular exercise, healthy food, maintain normal body weight, minimize sitting duration, quit smoking, abstain from alcohol, reduce stress, keep BP below 120/80, keep HbA1c below 5.7, maintain normal cholesterol levels, and maintain normal homocysteine, that is below 15. So I hope you enjoyed this, and I'm sure if you have any comments or queries, please post it here. Like this video, share this video, and subscribe to this channel to have more similar educative videos in the future. Thank you.